So it is really important that we are building appropriate strength, and this is really unique to you, right? Like I say that there's some common muscles we know that we need to work on because there are some common patterns we see with impingement and labral tears, but the reality is every body is different. And so you have to make sure that you know where your specific imbalances are, and then that's what you're addressing. Hey everybody, I'm Dr. Jenna Lower, and welcome back to the Unchoreographed podcast, where we talk all things hip impingement and labral tears. Last episode, we talked a little bit about what happens when your body is holding tension and if it doesn't feel safe. Today, we're going to dig a little more into one of the biggest reasons that happens, which is a lack of stability. So if you are somebody who is feeling like your hips constantly feel tight, no matter how much you stretch or foam roll or do mobilizations, and you just feel like you can't release them, this episode is probably going to hit home for you. If you are somebody who's dealing with hypermobility, which I know a lot of you out there probably are, because hypermobility and impingement and labral tears really go sort of hand in hand. Many of our clients have both or all of those things going on. This episode is, again, going to really hit home for you. So let's sort of dig into this idea of mobility versus stability. And I think really one of the biggest misconceptions around it is that we've been taught if something feels tight, that we automatically need more flexibility for it. But the reality is tightness doesn't always mean that their muscle is physically too short. In fact, it can mean a couple different things, right? Sometimes it just means that there's resistance through the range of motion. It can mean that the muscle is physically tight, but often you will find that people sort of get stuck in this trap of stretching because you feel like you're supposed to, right? It feels tight. I need more flexibility, so I'm going to stretch. But then the problem is you go right back to moving the way that you were moving before you were stretching or foam rolling, and it tightens right back up. And so you keep getting stuck in this cycle, and now you're feeling really confused because, well, what the heck? I feel tight. I stretch the muscle. It doesn't change anything, or it doesn't stick, it doesn't last. So I want you to think about it this way. What if your body wasn't actually lacking mobility? It's just limited in its ability to access that mobility. And that's exactly where we start to talk about the differences between, or the connection between mobility and stability. And I think that this is what is going to make a huge difference for so many of you guys. Really understanding the way that they're connected and which you need to focus on. Mobility is, without a doubt, super important. You know, we have to have good mobility in our body to feel comfortable with our movement. And it will give you often these short-term gains. So it's not that it's, not ever the solution, right? We do a lot of mobility for people. But right today, what I'm talking to is the group of people who are doing the mobility and it isn't sticking. What do we do in that case? And usually what it means is you are probably just focusing in on the wrong thing. If you've been stretching, nothing is changing. We have to change gears. We have to figure out, why is your body not actually responding and changing to this? So that's the group of people that I really want to talk to today. So what is the difference between mobility and stability? Let's keep it very concise, very simple to understand. Mobility is essentially the ability to access a joint's range of motion. Okay, so to be able to flex your hip all the way up or rotate your hip all the way outward, whatever it is. I can access that range of motion. My joint can move through the movement. Stability is, can I control my movement, and can I control that joint through its range of motion? Most injuries or movement problems, there's like three main things that can happen that can create an issue. We have to look at the mobility in the joint, we have to look at its stability, or how well can it control through the range, and we also have to look at the movement control and the muscle coordination piece of things. And so how well you are able to coordinate all the muscles and make that joint move smoothly. Generally, when you have pain or you have an injury or problem or something like that, or an imbalance, I should say, it's an imbalance with one of those things or potentially a little bit of a combination of all those things. The problem arises when you are not addressing the main reason that you're struggling with this imbalance. So again, if you feel like you have a mobility problem, but it's an underlying stability issue, but you just keep attacking the mobility without addressing the real root, which is the stability, you're going to end up with a problem. And it can be any combination of that, right? The idea is we have to address where your imbalance is. And so again, if you're not listening to your body and understanding and assessing what's happening in your body, very often you are trying to change the wrong component, and that's why you keep getting stuck. So there's a quote that, and I really wish that I could remember who said this. So this is not my quote. I just truly can't remember where it came from or where I heard it. But it is something that I refer to often, which is a lack of mobility is usually masking an underlying stability issue. I'm going to say that again. A lack of mobility is often masking an underlying stability issue. So what does that mean? In simple terms, if your joint doesn't feel stable and safe, your body craves stability, right? It knows I need that joint to feel stable. I need some stability. So what it does is it tells all the muscles around that joint to tense and guard up and protect. I'm going to create this sense of stability. Look how strong I am. But the problem is it's not real. It's false stability. It's a false sense of support. It's your body trying to create stability that it's lacking. And so now you're left feeling like you have a mobility restriction. All that built up tension is making you feel like, gosh, I'm so tight in that joint. But then I stretch it and it doesn't help. Or in a lot of people with hypermobility or impingement, these are the people who tell me every time I stretch, it makes it worse. And again, it's because you're taking away that body's, even if it's a false sense of stability, you start to attack that sense of stability and your body doesn't like it and it guards up more. So we're really fighting against your body instead of getting the desired result or outcome that you think you're going to get. And so this can be a huge issue long-term with, again, sort of getting stuck in that loop or in that cycle of consistent feeling of tightness and not knowing how to address it. And it also just might be making your symptoms worse. So this is why stretching will often long-term not change an issue if your issue isn't muscle length, but it's stability. We have to address the root of the problem. So I would also say for our hypermobile bunch, this is exactly why it gets really confusing for you guys, because I think often you'll hear, well, God, you're so flexible. You're so flexible. So, we don't have to work on that, but you are still feeling really tight. And the reality is that feeling flexible or having flexibility, but feeling loose, it's not the same thing, right? You can still feel extremely tense and guarded, but have all the flexibility in the world. And this is where it's really important that we're addressing, well, why are you feeling so not loose? Why are you feeling so guarded and tensed? More stretching in a hypermobile person is not going to solve the problem. It's probably going to make you feel a little bit worse, or you'll just feel like nothing is changing, right? Because we have to remember that all that pent-up tension that's there, it's because the muscles are working overtime to try to support your joint. So how do we solve it? We have to go after the root, which is build more stability around the joint so that those muscles don't have to work overtime anymore. They don't have to create that false sense of support. And now you actually feel loosened up. In hip impingement, there are some common places and common muscles that we see this happen in. So one of the most common places that you'll notice this is hip flexors. So again, if you're listening and this sounds like you're not alone in this, right? The hip flexors often are gripping and creating a lot of tension. And, again, this is one where I see people all day long. They're stretching their hip flexors in this deep lunge position. And very often it does make things feel a little bit worse because of the position that you have to put your joint into. And worse than that, it doesn't make anything feel better. You still feel like you have this chronic built up tension there. A lot of people tell me, oh gosh, I thought I had chronic tendonitis that wouldn't go away. I had no idea that this was actually what was going on. It was a hip impingement issue, and my hip flexor just was weakened. And so it was everything around that joint was actually tensed and guarding up. And again, stretching is not going to solve that issue. So that's one of the common places we see it. Another really common place that we'll find this is in the deep hip rotators. And so the deep hip rotators are kind of the muscles that support the backside of the joint. They kind of help suction the head of the femur into the socket and create a lot of joint stability through your movement. They help control and coordinate the movement as you move through different ranges of motion. So hip stabilizer or deep stabilizers are extremely important in all of this. And they're one of the muscles that when we're lacking stability, we often see a chronic tensing or guarding to create that false sense of support. It's not an efficient use of the muscle. It's just neuromuscular tension. We really need them to be strong and be able to contract and control the way that they need to. So that's another really big area. Also, I would say the pelvic floor muscles, which do cross over with the deep hip rotators. Some of those muscles are the same, so it kind of goes hand in hand here. Goes without saying, a lot of times when people have a lot of glute restriction, they also have a lot of pelvic floor tension. And this may show up even in some weird places too, like if you notice you're somebody who holds a lot of tension in your neck and shoulders, if you are a jaw clencher or teeth clencher, and you have TMJ issues, that's often very much connected to pelvic floor tension. So there's a lot of areas that you can look outside of the actual hip itself to see, are you somebody who tends to hold a lot of tension? And so the jaw, that's a really big one to look into. But yes, the deep hip rotators and pelvic floor muscles certainly do like to hold a lot of tension, as well as there's another muscle called your glute med. This is another one of our hip stabilizers. And the glute med is really responsible for a lot of your single leg movement and control. And so that glute med often is, when it's weak or not stabilizing, we'll see a lot of excessive neuromuscular tension and guarding. So that overall the glute area, right? Just huge area that we will find this excessive guarding. Most of the time, it's actually not that it is too strong, it's that it's actually too weak. And so it's creating that tension to give you this false sense of support. What we need to do is repattern your movement so that it understands what it actually needs, which in this case is likely stability and not mobility. So hopefully that all makes sense. It can be a little bit confusing, but try to break it down as simple and put it in as simple of terms as possible. So let's dive into, I want to give you guys sort of 3 practical tips that you can use that will help you if you are struggling. So if you are somebody that is feeling like, gosh, this is really speaking to me. I do think that I'm stretching all the time and nothing is changing. Maybe it's not a mobility problem for me. Maybe it is this underlying lack of stability. So what are 3 things that you can do right now to start to make a change? So the first one we've obviously talked lots about already, but it's just as important. It is making sure that you are addressing the stability first. So if you guys have been around here for a while, you know I am really big on the framework that I use, which is learning the proper movement patterns and then building stability within those movement patterns. And that is exactly what you want to do here if you are feeling this constant lack of mobility. So in, again, the case of hip impingement and labral tears, the muscles that we are looking at, we are trying to build coordination and control through the range of motion in really any direction. And so the muscles that we really want to focus in on are those deep hip rotators, your glute med muscle, which is, again, largely responsible for a lot of single leg movement, pelvic floor muscles, your deep and inner core muscles. All of these muscles are areas where we want to make sure you have really good coordination in. Now, again, if you are somebody that is naturally holding a lot of tension here, we want to not ignore that there still is this sense of tension. So it doesn't mean that we are not going to address the tension at all, right? We don't want to just start building strength. We still have to address the tension, but we're going to maybe address it not in the way of just stretching. Maybe, again, this kind of goes back to last episode, but so if you want to hear more on this, listen to episode 14. And so really trying to go at the tension from the neuromuscular level. So the diaphragmatic breathing, some, meditation work, some mindfulness work, that can all be really helpful to kind of start to calm the tension down. But then we do have to make sure that we are starting to create stability around the joint. As you're building more stability and learning how to let some of that tension go, it's not that we want to just hold the tension 24/7, right? That's going to create a whole lot of other issues. So we have to find the balance between those two things. But as you do start to build the stability in these muscles, what will happen is the body will feel less and less like those muscles have to be constantly on guard and gripped and working overtime to hold the joint stable. So you'll actually will start to feel like, I feel strong in these positions now, not like I have to hold on for dear life because it feels like my hip is going to fall apart. So it is really important that we are building appropriate strength. And this is really unique to you, right? Like I say that there's some common muscles we know that we need to work on because there are some common patterns we see with impingement and labral tears. But the reality is every body is different. And so you have to make sure that you know where your specific imbalances are, and then that's what you're addressing. So the best thing I could say there is make sure you hook up with a physical therapist who understands this issue well, and they can give you an assessment and figure out where are your specific imbalances so that you're working on stability where it matters, not just creating or feeding into the problem more. So building stability, building control, that is the first tip. The second thing is working on, if you do feel like you still need a bit of mobility, which again is still important, but can we work on it a little different? So eccentric strength or stretching is one of the best ways that you can work on mobility if you are someone who is hypermobile, if you're somebody who is feeling like I've been stretching, but I still feel chronically tight. Eccentrics are extremely important. So basically what eccentrics are, it is a slow lengthening of the muscle, generally under a little bit of load. So I always use my bicep because I feel like it's actually a little bit easier for people to understand and see what's happening. So if you're watching this on video, you can kind of watch along as I do it. But in my bicep, there's two different types of contractions. There's concentrics and eccentrics. A concentric contraction would be if I just bent my hand up towards my shoulder. So I'm bending my elbow, doing a bicep curl, right? I'm taking the two ends of the muscle, I'm pulling them closer together so the muscle is essentially shortening. That's called concentric activation. If I am going the opposite direction, if I am lengthening, I'm straightening my elbow, I'm taking that muscle and the two ends are moving further apart, the muscle is lengthening. That is called eccentrics. Concentric is shortening, eccentric, length. So if you think about that, again, in relationship to a bicep curl, think about if you were holding a 20-pound dumbbell. If I bring my arm up, in a bent elbow position, I can lift the 20-pound dumbbell up. What's easier, that or trying to slowly release the dumbbell back down without gravity taking over and it just straightening out? So which one's harder for you or easier? Is it bending? Is it slow release? Most of the time, the more difficult thing is the slow release because it takes a lot more muscle fiber control and coordination to be able to control that movement through its lengthened position. So the same thing happens in our hip. We can do eccentrics for our hip flexor, for instance. So if it hurts every time you pull your knee up towards your chest, well, what if we switched it around and we had you slowly lower your knee down away from your chest under a little bit of load? We can do it with our hamstrings. We can do it with our glutes. You can do it with any muscle. But essentially what you're doing is you are creating length in the muscle versus shortening the muscle. We also do it under a little bit of tension or load. Sometimes it's just body weight or gravity, which is fine as well. But having it under load, that loaded stretch gives you more change in the muscle fiber than just trying to take two ends of the muscle and pull it apart and stretch it well. So eccentrics are really powerful for mobility. They also are going to build strength, but they are going to help you build a lot of mobility and control through the range of motion, which is essentially what we are trying to do. So that's the other tip is I would work a bit on eccentrics. And again, if you don't know how to implement that, what those look like, I will link below a couple of my favorites, but your best bet, link up with a physical therapist because they will be able to show you which muscles you actually need these eccentric strengths for or lengthening for, and then how to to do it for that muscle. But there's, lots of good ones out there, lots of good ideas of how you can do eccentrics. The third tip, and probably the most important one, is not forcing your body into ranges of motion, especially if it doesn't feel safe. Hypermobile people, I'm definitely talking to you on this one because I think, I see a lot of dancers. So dancers are one group who tends to overstretch. They sit in these over splits where you essentially prop your foot up on blocks and then drop down into a split and just hang into that joint. That can be really damaging, especially if you already have too much mobility in the joint. We want stability there. We don't want to overstretch that joint even more. But even if you aren't a dancer, overstretching can still be a problem, but it might just look more like I'm stretching into a range where my body is fighting itself. Instead of feeling relaxed into that position, I actually feel more tension and more guarding. Most of the time when you do this, this is where more pain shows up. This is where most people will feel like after I stretch, I feel 10 times worse. It actually flared my symptoms up. And it's often because, again, your body doesn't feel safe in that range. It creates more tension and guarding because it doesn't feel comfortable going there. It doesn't feel good to your body. And so your body tries to protect itself. It doesn't want to feel pain. And so it tenses up more, which is great, except it also then creates you still feeling more pain. So we have to be really careful and cautious to not push through things that don't feel good to our body. In the case of impingement and labral tears, I generally am not doing a whole lot of mobility with people right in the beginning. There may be a few very isolated things. I think internal rotation is one of those things that often is a bit locked up, but it doesn't often look like I'm just going to statically stretch it. It usually looks a little bit more like I'm going to activate through the range of motion. I'm going to do some eccentrics. I'm going to control through the mobility. I'm going to warm the muscle and use it and activate it instead of just trying to stretch it alone. So there's a place for mobility, but how you do it is going to be really important. And so, like I was saying, mobility and stretching, I shouldn't say mobility, but stretching is not often something I start with my hip impingement and labral tear people. Later on down the road, do we implement it? Yep, absolutely. There's always a place for it, but it's not generally where I start with, because the body often just doesn't feel safe there. So we have to pick a way, how can we still gain the mobility, but in a way that your body feels safe doing so. So a lot of activation style exercises are great. An example off the top of my head for this might be, maybe it doesn't feel good to sit in a 90-90 hip stretch. That's a kind of intense hip rotation mobility exercise that we see everywhere, and it can be really helpful for some people, but for others, it's way too intense. So, but I know I need more mobility in rotation. So could I instead do maybe a sideline clamshell or a standing hip airplane where I have to still gain mobility, but I'm going to work through my body's mobility and I'm going to activate the muscle instead of just trying to stretch it into end range. And that often will release the tissue far more than just trying to stretch will. So we just have to sometimes change how we are going after mobility if it is something that your body needs. But to sort of recap all of this today, because this was a lot and it can be really confusing, the thing that I really want you to take away from the episode is that if you're feeling tight, but nothing has changed it, I want you to remember that more flexibility is not always the answer. Do we need mobility? Yup, 100%. However, it won't get you anywhere if you don't have the stability and the control through the joint's range of motion. So we have to make sure that we are balancing mobility and stability alongside one another and addressing where your imbalance even is to be able to see lasting changes. Addressing stability first often is what will actually help your mobility more long term, even though it probably doesn't feel that way. Mentally, it doesn't feel that way. It feels like I'm tight, I need to stretch. That makes sense to us. Like we always want to stretch something that hurts, but you can't stretch your way out of a stability problem. You have to strengthen and stabilize the joint. And then, yes, I'm still going to work mobility, but at least now my joint feels well supported. And so I can actually access the mobility in a controlled way through the full range of motion that doesn't flare my symptoms, but it actually makes me feel better. So if you guys are hypermobile out there, this is invaluable to you guys, especially. I mean, anybody struggling with impingement and labral tears, I want to make sure that you're kind of understanding this, but especially if you're dealing with hypermobility, this is the piece that you might most likely are missing if you haven't addressed it yet. So this week, what I want you guys to do, pay attention. Pay attention to your bodies. I want you to pay attention to what feels really tight on you, and maybe where do you feel a little bit more unsupported. And if you are trying to stretch, is that stretch changing anything? And if the honest answer is, well, no, I feel like I just only feel good immediately after that stretch, maybe we need to look at a different tactic, a different strategy. Maybe you need to come at that tension from a different angle and start to look at, well, how am I moving and where do I feel like I am maybe lacking some stability? And can I come at it from that angle instead to see if it improves that tension that I'm having? As always, if you have no idea where to even start with this, because it can be really hard, but the first step is making sure that you assess and understand what's going on in your body. So if you have no idea how to do that and where to start, you guys know where to find me. Drop me a comment below because I'm more than happy to help you with that. But I would strongly suggest trying to hook up with a PT in your area, somebody who is specialized in hip impingement, hypermobility, all those good things, because they are going to be able to help assess what's happening in your body and give you the things that you need most. As always, guys, thank you for joining me today. If you have any questions about the episode, if you have any questions about what you can start doing on your own, drop me a comment, question. I'm happy to keep the conversation going. I always love having conversations with you guys, and I look forward to seeing you right here next week on Unchoreographed. Have a good one.